at first his wife got sick and she needed an amputation of her leg. His insurance did not cover that. Later on down the line, he ended up needing amputation of one of his limbs also because of his blockage. His insurance didn't cover that either, of course. And so that led to the loss of his business, the loss of his home, and all of his funds were bankrupt, all because of not having adequate insurance to cover the needs.
My name is DeBruycker. I'm from Minnesota, and I'm a registered nurse. And I've been involved in the Heart Association for a number of years as a volunteer as a nurse. But this year, these issues speak to me more dearly and personally than any other issue I've ever been involved in. We talk about adequacy of care and access and affordability, and I witnessed that firsthand with my daughter. My daughter was diagnosed with bone cancer when she was 19. She was young, she was a college student getting on with her life. And I thought I understood healthcare. I thought we had good healthcare insurance. And realizing what happens when you have a rare disease that makes you go out of network, what those deductibles cost, what without a cap, I'm still paying bills. My daughter died 6 years ago. And one of the things she wanted was this to be different for other people.
I'm very frustrated with healthcare as it is right now, and I want to see positive improvements for him so he can be covered and no longer be underinsured. I want him to be adequately insured so he can continue on with treatments, which he's getting treatment. However, as an adult, he's going to have to suffer and be faced with having to pay out of his pocket for what he needs.
In 7th grade, I was diagnosed with a heart defect, which required surgery eventually. We just didn't know when. At 18, I underwent my first open heart surgery, and 20 days later, they did emergency surgery. Then in 2006, after I started back to school and was working towards my degree, the insurance company dropped me. I couldn't find affordable or adequate coverage that would cover what I needed or that I could personally afford to pay for. So that's why I'm here today. It's something that needs to be heard. I don't think they realize how many issues are out there with people that can't find the coverage needed.
My son Luke was born with 4 separate heart defects, and since then I became affiliated with the American Heart Association, and I guess trying to get the word out that heart disease is not just an elderly issue.
As a survivor, 7 years ago, I was surviving cancer and basal cell carcinoma when I developed a very rare central nervous system vasculitis. I stroked out, had seizures, became paralyzed, and I'm a miracle to be here. Because of family and faith and good health insurance, I'm here to tell my story.
I lost my job, a 6-figure income, with a food service company, and I lost it due to health reasons because we were a self-insured company, and self-insured people do not like to have risk people on their payroll. So I was basically uninsurable at that time. I had the insurance through the COBRA plan for 18 months, lost it, and then I was basically unemployable and uninsurable.